Dear learners, myself Mr. S.K. Patil, Department of Pharmacology, Kisan Vidya Prasarak Sanstha, MAH College of Pharmacy, Boradi. Now, today we will discuss on the first topic of pharmacology syllabus according to PCI and Education Regulation 1991, Introduction to Basic Pharmacology and its scope. Okay, so contents of today's presentations or discussion. It includes the definition of pharmacology, meaning of drugs, various sources of drugs, scope of pharmacology, different branches of pharmacology, and lastly, theoretical index. So, first of all, pharmacology. So, term pharmacology is derived from the two main Greek words, pharmakon, that means the drugs, and logos means the science or to study. Okay, that means pharmacology is nothing but all about the study of drug effect on your body, and body shows the response for the drugs. Okay, it means the knowledge of history, sources, physical and chemical property of drugs, absorption, distribution, metabolism and excretion of the drugs, and therapeutic effects and uses of the drugs. Pharmacology म्हणजे काय? All about the study of drugs. म्हणजे that means it includes the detailed information regarding to the drugs. Okay, when any substance or any molecules or medicines that interact with your living systems through the chemical processes. तुमचा एखादा सबस्टन्स तुमच्या बॉडीच्या लिव्हिंग सिस्टीम सोबत इंटरॅक्ट होत असेल कशासाठी? टू मेंटेन द physiology of your body, to maintain the physiology of your body. म्हणजे imbalance in between your physiology at the times you take medicines. जेव्हा तुमची फिजिओलॉजी मध्ये चेंजेस असेल, फिवर होत असेल किंवा एखाद चिल्स असेल, स्नीजिंग असेल, कपिंग असेल किंवा कुठला तरी डिसऑर्डर तुम्हाला बॉडीवर झाला असेल, ॲट द टाइम्स यू टेक अ मेडिसिन्स और ड्रग सबस्टन्स. कशासाठी ड्रग सबस्टन्स घेतो? टू मेंटेन द फिजिओलॉजी, नॉर्मल फिजिओलॉजी ऑफ युअर बॉडी. Okay, so by means of this drugs, this shows the pharmacological or desired or undesired effect on your body. So drug, that means the meaning of drugs according to the WHO, World Health Organization's the definition of drug is the any substances or products that intended or to be used to cure or prevention or treatment of the disease or disorder to the human beings and animals. That means the any substances that administer for internally or externally for the diagnosis, prevention, cure, treatment of the disease or disorder to the human beings and animals. So the drug molecules, they interact with your living systems and shows the desired or undesirable effects. Okay, so how they get show effect on your body? They binding with the receptors. After the absorption, they bind with the receptors and shows the pharmacological effect. When the drugs are bind with the receptors, only at the times they show the effect. Otherwise, the drugs are not able to show the effects. Okay, it's depend on the drug affinity and drug efficacy. So drug affinity, that means the tendency of drugs that shows the bind with the receptors. That means the tendency or ability of drug that bind with the receptors. And drug efficacy, that means the ability of drugs that shows the effect of on your body. Okay, so next one is the pharmacokinetics. So these are the main two branches of pharmacology, pharmacokinetics and pharmacodynamics. That means the pharmacokinetics, the word indicate pharmacokinetics, that means the movement of drugs. Pharma, that means the drugs, and kinetic, that means the movement. So the movement of the drugs, the one compartment to the another compartment, one place to the another place, that means is all about the movement of drugs. So what the body does to the drugs, तुमची बॉडी ही ड्रग सोबत काय करते. ओके, आफ्टर द ॲडमिनिस्ट्रेशन ऑफ ड्रग्स, व्हॉट द बॉडी डज टू द ड्रग्स, बॉडी ही ड्रगला काय करून घेते. सो इट डील्स विथ द स्टडी ऑफ ॲब्सॉर्प्शन, डिस्ट्रीब्युशन, biotransformation and excretion of drugs. So absorption, first step of the pharmacokinetic, that means the absorption. So absorption is the movement of drug molecule from the site of administration into the circulation. जेव्हा तुमचा ड्रग ॲडमिनिस्टर केला बाय एनी रूट्स, oral routes or internal routes or parenteral routes or topical routes, okay, when the administration of drugs at the times of or the from the site of administration to the up to the systemic circulations. Second one is the distributions. After the absorption of drugs go to the systemic circulation and they distribute into the various body compartments. They distribute into the various body compartment in the small portion or small concentration. That means the movement of drug molecule from the circulation to the tissue and various different body parts. Okay, that means the distributions. Okay, at the times. Then next one is the biotransformation. Biotransformation is also called as the metabolisms and fate of the drugs. That means biotransformation, it includes the one chemical form changing into the another chemical form. That means the conversion of drug from one chemical structure or one chemical form into the another chemical forms, that by the using of enzymes or with the help of enzymes. Okay. Then lastly, excretions. Excretion, that means movement of drug molecules out of the body. Okay, and next, pharmacodynamics. So pharmacodynamics is nothing but what the drug does to the body. Drug body वर काय effect show करतो, that means the pharmacodynamics. Okay, so it includes the biochemical reaction of the drugs, physiological effect of the drugs, mechanism of action of the drugs, all the effects and actions shown by the drugs. This study is called as the pharmacodynamic study. So some questions arises in your mind. So ask yourself, why you are taking the medicines, and what happened after the administration of drugs, or what happened when you take the medicines. जेव्हा तुम्ही मेडिसिन का घेता आणि मेडिसिन घेतल्यानंतर तुम्हाला कुठल्या प्रकारचं इफेक्ट किंवा मेडिसिन घेतल्यानंतर तुमच्या बॉडीमध्ये काय चेंजेस होतात. सो व्हेन द ॲडमिनिस्ट्रेशन ऑफ ड्रग्स, फर्स्ट ऑफ ऑल वाय यू टेक द मेडिसिन्स. तुम्ही मेडिसिन का घेता, तो मेडिसिन आपण का घेतो, जो एनी चेंजेस और एनी फिजियोलॉजिकल चेंजेस इन द बॉडी, काहीतरी फिजियोलॉजिकल चेंजेस बॉडीमध्ये झाले असतील, डिसीज और डिसऑर्डर झाले असतील, ते क्युअर करण्यासाठी किंवा ते प्रिव्हेंट करण्यासाठी, डायग्नोज करण्यासाठी, ट्रीटमेंट करण्यासाठी आपण काय करतो, मेडिसिनल सबस्टन्स हे घेत राहतो. ओके, किंवा घेतो. त्याच्यानंतर मग मेडिसिन सबस्टन्स घेतल्यानंतर आपल्याला जो डिझायर फार्माकोलॉजिकल, जे एक्सपेक्टेड फार्माकोलॉजिकल इफेक्ट असेल, तो एक्सपेक्टेड फार्माकोलॉजिकल इफेक्ट आपल्याला तो बॉडीवर शो होतो. किंवा इन सम केसेस और इन सम टाइम्स दे शोज द अनडिझायरेबल फार्माकोलॉजिकल ॲक्शन्स. किंवा काही अशा वेळेस तो एखाद वेळेस अनडिझायरेबल, जे आपल्याला नकोसे असे इफेक्ट बॉडीवर शो होता, किंवा साइड इफेक्ट्स, ॲडवर्स इफेक्ट, टॉक्सिक इफेक्ट्स और अनइंटेंडेड इफेक्ट्स इज शो ऑन युअर बॉडी. Okay, nextly they shows the drug effect, desirable effect and undesirable effect. So desirable effect, that means the expected pharmacological effects. It is also called as the expected pharmacological effect. When you take the drugs or when you administer the drugs for the diagnosis purpose, various tests you done for the various tests for the diagnosis of disease or disorder in your body. Then next, prevention of drugs. Various vaccines are available to prevent the drugs, to prevent the disease or disorder to the body, and treatment given to treat the disease or disorders. These are the desirable effect, that means the expected pharmacological effects, and undesirable, that means the some side effects, adverse effects and toxic effects are produced by the drugs. Okay, so next one is the sources of drugs. Sources of drugs, that means the drugs are obtained from the various sources, or the ड्रग हा कुठून कुठून ऑब्टेन केला जातो. ओके, सो नॅचरल सोर्सेस, इट इन्क्लूड नॅचरल सोर्सेस अँड सिंथेटिक सोर्सेस. नॅचरल सोर्सेस, दॅट मीन्स द प्लांट और व्हेजिटेबल सोर्सेस, देन एनिमल सोर्सेस, माइक्रोब सोर्सेस, देन mineral sources. These are the various natural sources are available, or the obtain the drug from these sources. In that first, natural sources, plant sources, okay, or it is also called the vegetable sources. It includes the alkaloids. Which are the alkaloids? That means you already know about the alkaloids. Alkaloids are the nitrogenous organic compounds, or they are the alkali substances, or they are the alkali compounds. Okay, they shows the physiological actions when administered into the body. For example, it includes morphine, cocaines, atropines, quinines. They are the various alkaloids are obtained from the plant sources. Okay, the next one is the microbes. Okay, microbes, that means that these are the drugs which are obtained from the these are obtained from the microbes or the microorganisms. They are obtained from the microorganisms. For example, antibiotics. Some are antibiotics or species of antibiotics which are isolated from the microorganism, such as Penicillium, Streptomyces, or the various species of the antibiotics. They are obtained from the various species of microorganisms to treat the microbial infections. Okay. Next one is the animal sources or animal tissues. The most of important hormones used in your body, for example, insulins are used in a treatment of diabetes mellitus. In case of deficiency of insulin secretion in our body by the pancreas, so at the times the replacements therapy, that means the insulin are obtained from the animals and they inject into the body to maintain the insulin level in your body. Next example, growth hormones, thyroid hormones. So these are the various animal secreted or animal sources drugs which are used to treat the disorders or disease in the body. The next, minerals, it includes the few therapeutic agents. Okay, it includes the ions used for the treatment of anemia, zinc used for the treatment of wounds, iodine is used as an antiseptic, it is also used in a goiter. Then lithium compounds is used for to treat the bipolar mental illness. These are the all are the natural sources of drugs. Then second, synthetic sources of drugs or artificial sources of drugs. Okay, so synthesize the new compounds include aspirins, barbiturates, or chemical compounds, local anesthetics. These are the all are the synthesized or the chemical compounds. They are synthesized in a laboratories. Okay, so modified naturally occurring drugs, it includes the semi-synthetic derivatives of the natural occurring drugs. For example, cocaines, morphines. These are the semi-synthetically obtained or modified drugs obtained by the semi-synthetic derivatives. Okay, or in some cases the new compound or new drug molecules are discovered by accidental when drug molecules are used for the another purpose. फॉर एक्झाम्पल तुम्ही एखादा ड्रग घेतला असेल, सपोज तुम्ही एखादा ड्रग ॲडमिनिस्टर केला असेल तर डिझायर फार्माकोलॉजिकल ॲक्शनसाठी, पण अशा वेळेस काय होतं की एखाद्या वेळेस तो ड्रग्स काय करतो, अनडिझायरेबल किंवा ॲक्सिडेंटल इफेक्ट शो करतो वेन युअर बॉडी फॉर द दे बाय ॲक्टिव्हिटी ऑर द स्क्रीनिंग ऑफ द ह्यूज नंबर ऑफ रिलेटेड मॉलिक्यूल फॉर द स्पेसिफिक फार्माकोलॉजिकल ॲक्शन. म्हणजे काय करतो, ॲक्सिडेंटल इफेक्ट्स किंवा अनइंटेंडेड और अनएक्सपेक्टेड इफेक्ट शो करतो, त्याला म्हणता आला दे आर सिंथेटिकली source of the drugs. Next one is the various branches of the pharmacology. It includes the therapeutics, chemotherapeutic, toxicology, pharmacoepidemics, pharmacoeconomics, pharmacogenetics, toxicology. So first of all, pharmacotherapeutics or the therapeutics, the branch of pharmacology that deals with the arts and science of treatment of disease. So that means the application of drug molecules for the pharmacological effects or for the cure or the prevention of the disease is called as the therapeutics or the pharmacotherapeutics. Next one is the chemotherapy. So in that chemotherapy, that means the use of chemical substances to treat the disease or disorder occur or the caused by the microorganism or neoplastic cells. So the use of chemical agents, simply the use of chemical substances or chemical agents to treat the microbial diseases. Okay, that means the chemical that kill the cells, especially those microorganisms and neoplastic cells. Okay, next one, toxicology. Toxicology is, that means that the branch of pharmacology deals with the study of poisonous effects or the adverse effects of the drugs on your body. It deals with the symptoms, mechanisms, treatments and detection of poisonous caused by the different chemical substances is called as the toxicology. That means simply the study of the effect of poisons. Okay, next one is the clinical pharmacology. So clinical pharmacology, that means is the scientific study of drugs in our man or the volunteer, human volunteers, or includes pharmacokinetics, pharmacodynamics, investigations in a healthy or the diseased individuals. It includes the comparisons with the placebo, that means the empty drugs. So drugs that market, also the comparisons of drugs into the market and surveillance programs. That means the clinical pharmacology. So in pharmacoeconomics, that means the all about the study of cost of drugs. That means the pharmacoeconomics. In discipline with the cost of one drugs is compared with the another for the same purpose or the from the same uses. So cheapest drugs are papers. Okay. Next one is the pharmacogenetics. The branch of pharmacology deals with the genetic variations or the genetic information or genetic study is used to cause or the difference in the response among the individual or the populations. That means the genetic information is used to treat the disease or used to treat the infections. So pharmacogenomics. So pharmacogenomics, that means is the broader application of the genomics technology to the new drug discovery, for the new drug discovery of further characterization of the older drugs. Okay. Then next, pharmacoepidemiology. So pharmacoepidemiology, that means the deals with the effect of drugs on the large populations. That means the effect may be the good or harmful. The effect may be a good or harmful. So that means the pharmacoepidemiology, that means the study of effect of drugs on the large populations. Okay. Lastly, therapeutic index. So therapeutic index, that means the ratio of the comparisons or the compare the blood concentration at which the drug becomes a toxic or harmful, or toxic or harmful to the body. That means the safety margin of the drugs, safety or the margin of safety of drugs. Okay. That means the larger of therapeutic index, the drug having the larger therapeutic index is the safer of use of drugs. Or the drug has a smaller therapeutic index, the drug must be a close or the dosage carefully. So the person receiving the drugs should be a monitors closely. Okay. So because at the times the smaller the therapeutic index, the drugs chances to show the toxic effects. Okay. So next, the therapeutic index, that means measurement of the drug safety. The measurement of the drug safety, it refers to the relationship between the toxicity of drugs and therapeutic effects. Okay. So formula of the therapeutic index is equal to the toxic dose or TD50 upon ED50. ED50, that means the effective dose and toxic dose. Okay. So therapeutic index of the drugs is the ratio of the dose of that products toxicity to the dose of that products or produces a clinically desired or effective response. Okay. So TD50, that means the dose of drugs that causes the toxic response in 50% of a populations, and ED50, that means the therapeutic effects in the 50% of populations. So it is a ratio between the ED50 and LD50. Okay, or the TD50 or ED50. So a separate dose or separate drugs has been a higher therapeutic index. When the drug having the higher therapeutic index, it's a safer to be used. And when the drugs are the lower therapeutic index, is the closely monitoring the drugs, closely monitoring the patients or the drugs or the populations, or chances of toxicity is more. So more the dangerous the drugs has been lower therapeutic index, may require the regular monitoring of the drug levels. For example, in that warfarines, lithiums or digoxins, these are the lower therapeutic index drugs at the times. In case of warfarines, the treatment of or therapy of drugs with the warfarines, lithium or digoxins, the more the monitoring is required for the drug levels. Okay. Thank you. It's all about the study of pharmacology or basic pharmacology.